Liposuction is one of the most frequently requested cosmetic surgical procedures. While dieting and weight loss will decrease the overall size, liposuction targets specific areas, those that are diet and exercise resistant, allowing you to focus in on specific contour irregularities. Liposuction provides the means to safely and effectively contour the body by removing fat from the hips, thighs, knees, buttocks, and abdomen. The surgeon uses an instrument called a cannula, a long thin tube that is connected to a machine that creates a strong suction. The cannula is then inserted to break up the fat and suction it out. Although liposuction is not a substitute for weight loss, it can be very effective on areas that don't respond well to dieting and exercise. Fat distribution is determined by three factors: heredity, gender, and diet. Heredity determines the location and number of individual fat cells. This number of fat cells remains fixed and unchanged after puberty. Men accumulate fat more readily in the flanks and abdomen versus the hips and thighs for women. The quality and elasticity of the skin is very important. Think of liposuction like a balloon. As the air is removed, the skin of the balloon must shrink down to accommodate the new volume. Loose skin will not redrape well following liposuction. Your appearance after liposuction will be influenced by your general state of health, the overall condition of your skin, age, weight, hormonal influences, and other factors. Each person is unique, and during your consultation, we'll discuss in detail how these general factors apply specifically to you. Fat itself does not weigh very much. Most of the weight of the body is bone, muscle, and skin. Liposuction selectively removes fat only from those areas in which the patient desires reduction. Since the actual fat cells are removed, the procedure is permanent. Following liposuction, your body will always have less fat in the treated areas. It's up to you to maintain this new contour by remaining on an exercise and diet program. Remember that the fat cells that remain have the ability to get fatter, but their absolute numbers are reduced. Liposuction is not indicated in all individuals. Those that are obese or have a history of medical problems or poor skin tone may not be ideal candidates for the procedure. Most of our patients are done under general anesthesia in our private certified surgical facility. We use only board-certified anesthesiologists. By having my patient completely asleep, I can pay strict attention to the finest details, feathering and tapering the fat removal in order to give my patient a refined, contoured result. Most liposuction procedures are performed in 2 to 3 hours, depending upon the number of sites liposuctioned and the amount of fat to be removed. A compression garment is usually worn for several weeks following liposuction to reduce swelling and maximize skin contraction. Most liposuction procedures use the tumescent technique. This involves the use of a fluid which contains both an anesthetic and epinephrine. The fluid is injected in the areas of excess fatty tissue to be treated. The anesthetic in the fluid helps relieve pain, while the epinephrine helps constrict the blood vessels in the treated areas and helps to decrease bleeding. Ultrasonic liposuction is used for selected areas. This involves the use of a special cannula that transmits a wave of energy specifically tuned to fat. This allows us to direct the energy directly to the fatty deposits targeted for treatment, and essentially it liquefies them. Most patients can return to normal activities in as little as 1 week. Safety in all cosmetic surgical procedures is a big concern. Ultrasound is considered a safe procedure as long as it's performed by a plastic surgeon who is skilled in all body contouring techniques, including abdominoplasty, thigh lifts, and body lifts. The key to success in most plastic surgical procedures is selecting the correct technique and a good surgical candidate. If you're in poor health or severely overweight, then this is not the correct option for you. Every surgical procedure involves a degree of risk, and you should educate yourself as to the risks and benefits of any surgical procedure. Certain precautions will be taken in order to make this procedure as safe as possible. In general, we limit the amount of fat removed in the outpatient setting to 5 liters. Since there is 2.2 pounds per liter, this equates to about 11 pounds. By limiting the volume of fat removed, the chances of excessive bleeding are greatly reduced. I look forward to meeting you at your consultation, where we will discuss the procedure in great detail, and during your examination we'll identify areas of concern. More information can be found at our website at primacenter.com. Thank you.